Hi, Josh. Good morning. Thank you so much for coming on our show today. Marnie and I are really intrigued and interested in having you on our podcast to talk about something we really haven't touched on a ton yet. And Marnie and I myself have only been kind of recently diving into more regenerative medicine and learning more about stem cell treatment. So super excited to have you on and share what you're doing at your clinics in Mexico. And yeah, thank you for being here today.
No, thanks for having me. Happy to help out.
Yes. So before we dive in and talk more about regenerative medicine, one fun question we have for you is if you could instantly master any skill, doesn't matter what it is, what would it be?
Or master any skill?
Like,
I don't know. I've never thought of that before. But geez.
It's a tough one.
I think work, you'd think like marketing. I mean, that's the main thing I do here is kind of figure out what to do there. And it seems like it's always changing. And I definitely don't think I'm a master at that. So I think that'd be a good one off the top of my head.
You know, that's a good one, actually, Marnie. We would both like to master that skill.
So we can relate.
We can totally relate.
That's funny. Well, as we start to talk about you and your background, can you tell us about some of the pivotal moments or experiences that you've had in a nutshell so we can get into the heart of what we're talking about today that really led you to pursue a career in regenerative medicine and eventually open the DreamBody clinic?
Sure. So I always kind of joke that I Forrest Gump my way into this. It was not on accident. Or it wasn't on purpose. Yeah, I take it back about 20 years. My dad got Lou Gehrig's disease, and you just see how messed up the U.S. medical system can be when you have a terminal illness that has no cure. So he had this big aerospace company. I mean, literally was a rocket scientist, and he did his own research because there's no cure for it. He starts looking in, and he goes, well, if you got HIV, muscle wasting, like they throw growth hormone, testosterone, these medicines at you like you're a bodybuilder because you don't want the muscle to waste. And so he asked if he could have those. And we lived in Seattle at the time. And the doctor said, no, you can't have that. That falls under the Anabolic Steroid Act. He's 50 and dying. He's not going to go play pro ball. Like, why can't you have it? So, and just, it was crazy. So unfortunately, they gave him like a really low dose, didn't really get to explore that, explored other things, but he ended up passing from that. And I got into caregiving. So my plan was never to get into any sort of medicine. I figured I'd probably go do what he did. And I'm kind of glad I didn't because I was more like making missiles, bombs, and I'm not always the best thing. So I get to help people instead. And I got into caregiving. I worked for a place for mom, which is they help people find senior housing for their parents. I like caregiving, I like helping people, and read an article one day and it was like, man outsources parents to India. That's genius. Like you got great doctors.
Wait, what?
Yeah, that was the article. The headline said, man outsources parents to India. And I was like, that's pretty funny. I lived in Seattle. I lived in Redmond at the time where Microsoft is, and they outsource all kinds of stuff over to India for computer programming and things. I was like, that's too far.
But parents,
yeah, it's a little too far. But it does solve a lot of the problems in the U.S. with that. It's overregulated. It's too expensive. The care isn't that great. And I was like, well, you could solve a lot of those problems over there. Keep the costs down, not overregulated, great doctors, but too far away. So we used to vacation in Mazatlan, Mexico every year. And I thought, well, Mexico might work. And I just happened to have a friend that grew up with me that had moved here to Puerto Vallarta. He was doing real estate. And I was like, I moved down because my job was work from home and tried to see if it was possible and got really close with some investment groups. It just never quite worked out. And then I met my wife and her sister's a doctor and learned that there were a lot of these medicines we wished we could have got from my dad that we could get here. And it's legal, it turns out, to seek medical treatment abroad or return home with medication. So we got some lawyers, looked into it, figured out and created this fly-in-by program so people could come down and get like growth hormone or testosterone, some of these different things, regenerative medicines. And that's where it all started about 13 years ago. And then 9 years ago, you start hearing that they're doing stem cells in Mexico, but like there's a lot of rumors of stuff they're doing in Mexico, advanced stuff that's not always true. So we looked into it and we found a guy who'd done his PhD in cellular biology like 19 years ago and partnered up with him at first and got things going, and then ended up getting our own lab going and everything else. And that's what we've been doing for the past 8 years. So I mean, it wasn't like a straight line. It wasn't this, hey, I'm going to go, try to cure diseases. It was more of, hey, dad wasn't good. We wanted to help him. And now I think we could help other people.
So I have a question about that. So you are not a doctor, correct?
No, I'm not a doctor. No.
So are the people working in your clinic doctors?
Yes, we've got 3 full-time doctors.
Okay.
We've got 2 cardiologists, an internist, an anesthesiologist, and then we've got 4 biologists and 6 nurses. So I manage all that, have them work, but they're the experts. My job's to take what they teach me and just convey it in a simple manner, because it gets way too technical when you really jump into it.
Well, you had the dream and the vision based on this, unfortunate situation with your dad, and you pulled it all together. You're the connector with all the doctors and investors and, coming up with this brilliant idea. So that's really admirable, I guess I would say.
Yeah, thanks. So yeah, that's what we did. We wrote a book on it recently, and I think that's how we got connected. It's called The Ultimate Guide to Stem Cell Therapy, where it's not a technical book. The whole idea was to make it real simple so people could understand what this is, because stem cells get really confusing. There's a lot of bad info out there. And my job's been to kind of, focus it in and help people understand what it is, why it's safe, what's good, what's not, and, how to help people.
So should we dive right in? And I know we were talking before we hit record, just having our listeners understand a little bit more broadly speaking, like what is regenerative medicine and specifically stem cell therapy, at a higher level, like you said, kind of synthesizing it like you did in the book.
Yeah. So we always start then with like, what are stem cells? And people get confused because you hear stem cell and you just think this is a cell that's going to turn into any kind of cell you need it to. It's magic, right? You've got a problem, it's going to fix it. I mean, that's the kind of overlying, I think, presumption with stem cells. Mm-hmm. And it's not at all what we do. That was, if you remember in like the early 2000s, there was all that controversy with President Bush, like banned stem cells and all that.
Yep.
Well,
yeah, sure.
He didn't actually ban them. His advisors told him they didn't think it would work with what are called embryonic stem cells. These are from aborted fetuses and aborted babies. And right there, you've got ethical questions, right? For, like I'm Christian. For me, I didn't think it was too ethical, but the science, you could take it either way. That's whoever's decision on that. But either way, it never really worked. So he banned federal funding. The state of California still spent $2 billion researching it, and it didn't work. So his advisors were correct, but now that's what everybody associates with stem cells, these embryonic aborted baby like stem cells. Mesenchymal stem cells like we use, these were discovered in the early 1990s by a professor at Case Western University named Dr. Arnold Kaplan. So he was in charge of the Skeletal Muscular Institute there. We worked with him in the past, and he named these because in the lab, he could turn them into different cell types. When they started putting them into animals and then into people, they found they actually don't differentiate. They don't turn into different cells. They're more like the manager on the construction site. They send out these signals and they guide the healing process. So that's what they are. So even though they're called mesenchymal stem cells, he tried to change the name to medicinal signaling cells, but the name had already stuck. And I think the media really likes that it's kind of confusing for people. They've kind of kept this going. And so what we do, it's not really a stem cell when it's in your body. It's how your body healed when you were a little kid. And we lose that ability as we get older. So we put these in joints or we put them in IVs, and they help regulate the immune system. They help heal tissues, but they're not actually becoming those tissues. So that's kind of a quick breakdown.
And just to clarify, they're coming from your own body, right?
Not ours. So this is what's cool about them is that you can take them from your own body. In the United States, that's legal and okay. Yeah. You just can't. You can't, like, they'll do a liposuction, and it's kind of painful because they do local anesthetic. They take out all this fat. And then they put it in a centrifuge with this thing called collagenase and spin it, and that separates the cells from the tissue. But that's as far as they let you go in the US, because the rule in the US is called minimal manipulation, meaning you can go about to there, but any further trying to isolate the stem cells and administer is illegal. So they can do it from fat or from bone marrow. And it's good. It's better than nothing. But what they don't tell you, and Dr. Kaplan used to get really mad at groups in the US with this, like at conferences, because he'd say, that's a cell therapy. That's not a stem cell therapy, because less than 1% of that liquid you're administering is actually mesenchymal stem cells. Because it's no different than Coca-Cola selling you an apple juice saying all natural, and then you read the back label and it's actually 99% sugar and water. It's the same thing with those sort of cell treatments in the United States. So it's clever marketing. They call it a stem cell therapy because it has some stem cells, but it's not truly a stem cell therapy. So in places like Mexico, where we're at, and a few other countries, you could take that a step further. You could then isolate the stem cells from that tissue and then start culturing them in a lab environment. So we take ours from umbilical cord tissue and placenta. This is tissue that would have been thrown away otherwise. And even though it's from that baby kind of after birth, it's considered an adult stem cell because of how it works. And so we're able to isolate those and then culture them. And we can use them because they lack this marker that all of your tissue has called HLA, human leukocyte antigen. That's what says it's from your body. So like, let's say, Stephanie, you needed a kidney and I'm a perfect match, a donor. I give you a kidney. Your body's going to try and reject that kidney the rest of your life. You would have to take immunotherapies forever to not, because the HLA is different. The mesenchymal stem cells don't exhibit HLA, so they're called immune privileged. So they're invisible to your immune system. And so we take them from that tissue because it's the youngest. It's had the least amount of exposure to an immune system. So it hasn't built up any bad habits. And that's a problem with taking them from myself. Like if I had type 2 diabetes, I don't want my own stem cells. They're already not working properly. I want them from someone younger and healthier. So we take it from the youngest, healthiest source, and then they replicate the fastest. And we do all kinds of screening. We screen the women, we screen the tissue, we screen the cells. Everything's third-party lab verified to make sure it's good. And you get this good, safe, clean product that you're able to use.
So are you getting people that are coming to your clinic to donate their either babies, whatever, or like, how does that work?
Well, we work with a team of gynecologists that only work with first-time mothers. And we have really strict requirements, but we only need a new umbilical cord maybe every 3 or 4 months. We're not going through a lot.
Wow.
We get a lot of cells from these. We treat about 150 people a month. And most people are doing large numbers, like a 300 million IV or 50 million in a knee. I mean, we're talking tens or hundreds of millions each patient for treatments. So by the replication process, we get a lot of these cells. So we don't need very many donors, but every 3 or 4 months, we go through a new donor. And we got to make sure we say they got to be married. They got to be first-time mothers. They got to be between the ages of 18 and 25. We even ask how many sexual partners, because if they answer more than one, they're disqualified. And we even check if they've had any of the COVID vaccines, because a lot of our patients didn't want that and they don't want anybody who's had it. There's a federal database we can scrub against. And so we're very selective. And then we do all the screening and we're able to make sure we get the best tissue possible to have the best cells possible.
Wow. So very different process than the last person we spoke to. So it's super interesting to hear the differences in how you guys operate.
And you can do this in the United States, though, just so you know, like you can use an umbilical cord. That is legal. You just can't fully isolate the stem cells like we do. So there's like a couple of labs that sell them frozen to doctors, but we don't want to use frozen stem cells because the freezing and thawing process kills the majority of them. So, you're looking like maybe you can get 10 million cells from a whole umbilical cord and placenta, plus you're going to lose at least half of that with the thawing and freezing. So it's better than nothing, but we're able to take it quite a bit further here.
Yeah, so I'm curious, you mentioned that there are other countries that will do the same process with the stem cell therapy. contrasting from the US and what you can legally do. I'm just curious what those other countries are.
Oh, well, Mexico, Panama, the Cayman Islands are probably the most common.
Okay.
There are clinics in Colombia, even though the legislation isn't really clear on it. And then Japan and South Korea have a lot of research going on, but it really they don't have as many like private clinics, though. It's still a bit regulated there. So it's really like Mexico, Colombia, Bahamas. And the big problem is, and I mean, it sounds crazy, but it's the whole system in the United States is set up to kind of protect the pharmaceutical companies because a mesenchymal stem cell can't be patented. It's a naturally occurring thing. So the problem with the system in the US, and I know because I had a friend who had a clinic or a lab in Boise, Idaho, and their lab was trying to do these frozen umbilical cord cells that are legal in the US. There's a real famous lab out of Utah called Utah Cord Labs that does it. And so they went to do that. And when they did, they had all their, they GMP, ISO, their lab was perfect. And when the FDA came in, they said, no, that's a new medication. They're like, what? We're doing the same thing as these other guys. They're like, no, it's a new medication. So a new medication application, it's $2.5 million. So they were out at that point. They're like, this is pointless. And all that does, if you get approved, and they can deny you for any reason. And that's the crazy part. Now you have to go through all 4 phase trials of the FDA's process. Well, that takes about 10 years on average, and it can cost anywhere from $100 million to $1 billion to do. And you only get to pick one treatment. So if you look at my website, we got like 50 plus things that we treat. You would have to pick the most common, which would be arthritis of the knees. That's the most common thing we treat. So, okay, let's say you pick that. It's a big market. Great. Well, even if you made it through that whole process, you spend all this money and time, at the end of the day, even if you got approved, you would just open the market up to your competition, and they didn't invest $100 million, and you can't patent it. So there's no incentive to go all that way. And that's kind of the problem in the US system, is that the whole system is designed for developing new medications that can be patented, controlled, and profited off of. And it's not as much about the patient's health, unfortunately.
Right.
Yeah.
So that's definitely a problem. I'm wondering if we can change gears a little bit and focus more about like what kinds of issues do people come into your clinic? You mentioned the knee, the arthritis of the knee. What are some other common reasons people come in, and are most of them coming from the US? Are they local to Mexico? Who's your typical client?
Yeah, almost all our patients are from the US, Canada, UK, Australia. We get a lot from Europe too, but mostly US is number one. Yeah, we don't really treat many locals, just the way that we're kind of set up. We're geared more towards helping Americans, Canadians, Australians is probably the most top 3. And the most common treatment, like I said, is in knees. We can fix cartilage. We can fix arthritis in any joint. So lots of joints, ligaments, tendons, fix those. Herniated discs, lower back is probably our second most common treatment. I've had to fix sciatica myself before. It works really well. Herniated discs. And then a lot of autoimmune diseases, because this type of stem cell works by sending out these cytokines that interact with the immune system, and they reprogram it to basically, it's like hitting the factory reset button. Your immune system starts working the way it was supposed to. It protects the body instead of attacking it. So we see lots of like MS, rheumatoid arthritis, type 2 diabetes, ulcerative colitis. And then for certain like organ issues like heart failure, oh my gosh, we have like unreal success getting people's hearts back up to full function. Had a lot of people with cirrhosis of the liver get back normal, kidney failure. So it almost sounds too good to be true.
That's what I'm thinking too.
It totally does.
Yeah.
I mean, between the two of us, Marnie, how many people do we know that have one of the, 5 or 6 conditions that are debilitating? It's really impacting their quality of life. And I mean, this just it does seem too good to be true. So how do you answer that when someone, almost a skeptic who doesn't believe you, right?
Well, there are some clinics that focus more on celebrities, celebrity athletes. Like we get those people, but we don't focus on that for marketing. We have real people. Like just before we filmed this, I filmed with a returning patient. He's a veterinarian from Scranton, Pennsylvania. He actually does the fat-derived stem cells for dogs out there. And
Wow.
he came to us last year for his knees, and we fixed his knees. So we filmed a video. So we do videos with patients and we show it. We've got our own MRI machine at our hospital here. So, when people come back, we do new MRIs so we can show you the before and after. It's, you can argue the anecdotal stuff where someone says they feel better, but like you can't argue a before and after MRI when it shows that improvement. So
what does that look like? Okay, I want my knees fixed. I'm going to come to you. Is it a one and done? Is it like an injection and you're out the door? Am I coming 5 times? Like,
we're hoping it's one and done, but it's not always. It depends how bad the damage is. So like the guy today, he's like stage 3, stage 4 arthritis. That's bad. Stage 1 or stage 2 is usually a one and done treatment. Fly down. It's a quick, easy injection. It's the most anticlimactic thing you'll ever do. You walk out of the treatment, you're like, really? Like, that's all I had to do.
and do you feel the results immediately?
No. So typically, everyone's a bit different, but typically 3 to 6 months post-treatment is like peak results. And so like my left knee, my knees were the first thing I ever treated. My left knee, it was like a month and a half after it started feeling better, but then my right knee started killing me because I could feel the difference. Didn't treat it. I'm limping and I'm like, oh, dang. And then I did the MRI of that. I had multiple meniscus tears, partially torn ACL. It was way worse than I thought. And so we did that one, and it was like 3 months, didn't feel like much was going on. And then one day, just overnight, stopped hurting, and it's never hurt again since. And the MRIs show total tissue regeneration. So,
it makes sense that it would take a long time because you're allowing your body to heal on its own and regenerate, right?
Yeah. If you scratch your skin and you get a little like mark, like what's that take? Like a few months before it looks perfectly normal again. So think of it doing that on the inside of you. The only things that are usually really quick are like nerve pain tends to heal really quick. For whatever reason, nerves are just an easier tissue to regenerate. And like my sciatica was gone 10 days after I did the back treatment, never came back. And I've tried to hurt it again, dirt bikes, jet skis, all kinds of dumb stuff. It has stayed.
I find this so interesting. Like so many people have these issues that we're talking about, including myself, including my mother, my daughter, like, I can think of, like Stephanie said, so many people, and it boggles my mind that we can't get treated for this in the US, that we have to fly to another country to do this. And I'm wondering, is it the FDA red tape, or are there side effects? Are there, procedures gone bad? Like,
that's a good, actually, what's funny is all of the bad outcomes have been clinics in the United States, believe it or not, with doctors like, because think if you're taking it from fat, well, where do you store toxins in your fat? Right. So there was a real famous case of a doctor in Florida that was taking the fat derived cells and actually injecting them into eyeballs, which you don't have to be a doctor to know that you store toxins in fat. And she blinded like 3 or 4 people.
Oh my gosh.
There was another lab out of San Diego that like wasn't even really doing stem cells. I think they were using like amniotics. There's a really good podcast on Wonderly called Bad Batch that goes into it, but they gave all these people infections because it turned out it wasn't really regulated. They claimed it was. And you see us a lot in the US. And bad actors are going to like pretend things are above board because the US, you think, oh, they regulate everything. They're checking everything, but it's a huge country. It's tough to check it all. And so they hurt a lot of people. And what's crazy is their lawyer that represented all of these people, he's won every case in the United States suing stem cell companies and labs. And he ended up being our patient. So it's my favorite testimonial because we have mutual friends. And this guy, so he comes to my office and he sits down. He's like, oh, hey, Josh, I'm friends with Bobby. It's our mutual friend. He goes, you know what I do for work, right? I go, oh, no, what do you do? And he goes, I sue stem cell companies. So it's better work then. And we did treatment. We ended up fixing his bronchitis he'd had since he was a little kid. And It's my favorite testimonial because he starts it out saying, "Hey, I'm Brian Mahaney. I'm the top lawyer. I sue stem cell companies. And, these guys at DreamBody Clinic fixed me." So
that's a great story, actually. So going back, I think Marnie asked, are there any implications or side effects? So it sounds like a very quick procedure. Maybe you have to come back a couple times if you've had this chronic pain or condition for many, many years. But otherwise, it's like a high success rate, low sort of healing process. That's what it sounds like, but I guess I'm just asking.
The IV, you could get a mild fever. Joints, any joint treatment runs a risk of infection because it's a needle piercing skin. We've never had an infection, but if you go and get a blood draw to test your blood, you run that same risk. So that's not a problem. But that's why you have to go somewhere where the lab does it right. I mean, if you saw our air filtration system on our lab, it's like it costs a fortune. You have to keep a very sterile environment. You have to do things right. And there are places that don't, but look, I'm American. I know that because we're in Mexico, people have a bad perception here. I know I did before I moved here. So we have to keep our standards above what you would expect in the United States. And, if you read our reviews, that's the first thing you'll notice. Everybody complimenting how clean it is, how nice it is. We go out of our way to make sure it's the most sterile environment you can have, that you're getting the right thing. So as far as side effects go, it's crazy. And you can look through the studies. I mean, it has been studied extensively. If you go to PubMed, there's over 30,000 studies on mesenchymal stem cells. If you go to Google Scholar, there's over 100,000 studies. Wow. So the FDA can't argue there aren't enough studies. There's plenty of studies. It really comes down to that. You've got first this whole system to protect these pharmaceutical companies. And then Canada is a great example. Canada, about 9 years ago, or even 7 years ago, was allowing what we do. And then the orthopedic surgeons got wind of it, and they threw such a temper tantrum to the government, they got it shut down completely. So now you can't get any stem cells in Canada. And there was a huge clinic out in Ontario that was doing exactly what we do. That got shut down because the orthopedic surgeons didn't want to lose their business. And unfortunately, it's more financially driven than it is patient
helping
health.
People. Right. I mean, at the end of the day, we all want people to be healthy and have a high quality of life without going bankrupt in the process, right? It shouldn't be so expensive for people to be healthy.
Yeah.
So I'm wondering, the name is DreamBody Clinic. Do you do cosmetic procedures?
Look, we started out with the hormones, with human growth hormone. I mean, every celebrity is on human growth hormone.
So just to understand human growth hormone, that's to make you taller, right?
Well, for kids, yes, but for adults, they just did a study that confirmed it, but it actually has some very good anti-aging benefits. So they gave 10 men human growth hormone for the course of a year with metformin and DHEA.
Oh, yeah. Okay. I know.
Yeah,
I know them as those names.
You know that, Marnie.
Yeah.
So they did what are called DNA methylation tests, and that checks your epigenetic age versus your real age. And they found you think growth hormone with those supplements after the course of a year, all of the men were 2.5 years younger on average. So we know it's turning back the clock a bit. And then stem cells do even better on that. I mean, the DNA methylation test results we're getting back from people are just incredible. The last one I got, the guy's 67, I think. No, 62. And his epigenetic age is coming out at 42. And he's done,
what did he do?
Well, the stem cell therapy, the craziest one I have, and it's, again, I've got the testimonial, but the lady's 67 and her husband's 70. She's done the 100 million IV of the stem cells every year for the past 5 years. And she went and did one of his DNA methylation tests, and her epigenetic age came out at 27. And her husband, who's done his knees, but never the IV, his came out at 85. So that pretty well.
And how old is he?
He's 70. And they're both very, if you can see in the video.
So he came out older?
But he didn't do the IV. He'd never done the stem cell IV, only she had. So even though they're both really healthy, really good shape, he was looking older. And so that convinced him to start doing the IV treatment. once he saw her results, because everything else they do is the same. Eat the same, they train the same. So we're getting good results.
I want to back up for 1 second. You said something that caught my attention about the DHA and metformin and all of that. Is there any possibility of contracting like a cancer or having your cells go crazy from some of these treatments?
We've never seen that. And we work with, we've worked in the past with like Dr. Williams Cancer Institute. He's told me he's injected mesenchymal stem cells into tumors and actually seen them shrink. Not completely. So like he doesn't think it's a cancer treatment. He's got better things for that. Williams Cancer Institute, they're amazing if you look into them.
Where are they located?
He does his most advanced work in Cabo, but he's got clinics in, I think, Atlanta, South Beach, and Beverly Hills. Huh. But like he's the smartest person I've ever. I mean, his side project 16 years ago was doing stem cells like us in Mississippi till the FDA came after him and grand jury injunctions. Like, and they let him go because he was doing it for free. It was just a side fun project, but that's what made him realize he couldn't do his more advanced cancer stuff in the U.S. And he does most of it in Cabo, but he's in stage 2 trials in San Diego right now for these immunotherapy treatments that he's doing for cancer. It's incredible. So if you look through the research, there's no definitive. So we have a rule. We won't treat anyone that has cancer or has had cancer within the past 5 years, just to stay safe, because, well, they're going to blame the stem cells if something flares back up, whether it was or not. And we can't prove that. So these are not a good treatment for cancer, but they don't cause cancer because, again, they're not turning into other cell types. So they can't turn into like a cancer cell or something. In fact, they seek out inflammation and then they guide the repair of what's causing that inflammation. And most cancers and most diseases start with chronic inflammation. So if anything, you could argue that they're cancer preventative. Growth hormone converts into IGF-1 in the liver, and certain tumors do feed off of increased IGF-1 levels. But again, you'd have to have cancer and know that you had it and keep taking it to have any sort of issue. And my mom's a great example. I finally convinced her to get on it, but she didn't tell me she had a mark here and here, and it ended up being melanoma. So she'd been on growth hormone for like a few weeks. And she freaked out. What do I do? I heard this will make it worse. I go, just stop taking it, Mom. It's only in your system for 12 hours. She stopped taking it. They cut the things out. She's had no issues. That was like 5 years ago. Totally fine. So there's no real cancer risk to these things. We've never had like patients getting cancer. I think I'd be out of business at this point if we were having issues. So, yeah.
True. So you've shared a couple like success stories from the standpoint of like looking at your biological age versus your chronological age. But can you share maybe a success story with someone who came in more from like pain or autoimmune conditions and how doing the stem cell treatment and the therapies helped them?
Yeah, sure. And I mean, luckily we've got all these on the site so you can see them too on our YouTube. But we had one guy from Texas that was pretty close to my age. Like, I think he's probably like early 40s now or maybe late 30s. And he had MS and he had all these brain lesions right at the optic nerve center of his brain. So you could see those on the MRI. We did treatment and according to the new MRIs and his symptoms, he's symptom-free. All the brain lesions are gone and he's had no flare-ups, it's been many, many years and he's had no issues with MS. So that's not supposed to happen. You're not, look, I've seen patients with really advanced MS, like where they're wheelchair bound, haven't had as great a success there, but with younger people that, catch it earlier, we've got people that are in full remission from that. It's crazy to see it.
Have you seen anyone come through with Alzheimer's or dementia?
We have, and we haven't seen it really work. Early onset dementia, like if you catch it, say if you're 60 or younger, it seems to slow it down or stop it. But we don't get a lot of that. And I've tried for people with more advanced. And we do a treatment that for like MS or for the brain, for stroke recovery, traumatic brain injury, or for when we did try to treat dementia, we go into the lower back and we go into the spinal cord fluid. And this is how pure and safe these are, because if you get a bacteria or something in the spinal cord, you've got a major problem. So like, I've done this treatment twice on myself, so I don't just talk about these things. I've done every treatment. That allows the cells to go up the spinal cord fluid to the cerebral spinal fluid and start repairing. So they start repairing damage. They start, you have a very specialized immune system in the brain. It's mostly what are called glial cells. These are special macrophages that help get rid of waste and, clear things out, because it's a big neural, electrical network. You don't want anything interrupting it. So they can move those things out, and then they can help guide neurons to regenerate different areas. And we've seen some stroke recovery, for MS, for traumatic brain injury, these sort of things, unreal. But for dementia, Parkinson's, and Lou Gehrig's disease, unfortunately, my grandparents both died of Parkinson's. Dad had ALS, Lou Gehrig's. I wish I could fix those, but it doesn't seem to really make a difference. So it helps a lot of things, but even though they sound too good to be true, there are things that, they have their limits. So.
Well, no, I'm just thinking, okay, so what about preventatively? So a lot of our listeners may be feeling fine right now, but they're really focused on longevity. Like Marnie and myself are really focused on longevity. How can your treatments in your clinic help someone who's healthy, maybe in their 50s or 60s, but they don't have any significant pain, they don't suffer from an autoimmune condition? It sounds like you're dabbling in doing some of this yourself, but how could you preventatively use stem cell to live a long, healthy life?
Yeah. So, that's what I do. We get a lot of patients that do that. The 100 million IV is sort of our anti-aging protocol, we call it, that goes through your system, seeks out inflammation. Like I told you, we're seeing these great results on before and after DNA methylation tests. We do have a facial treatment where we go into the, insulin needle first, all throughout to help with the collagen, fat regeneration. And then we have this really cool, needle-free device that pushes PRP cells in. It uses this electrical signal to get it into the lipid layer. So, we do some of those different things for more facial and just whole body anti-aging. And then the growth hormone, that's kind of been, the long-term thing. But that one is definitely the vanity side, and it's not right for everyone. That one, I always say, it's usually you want to start with hormone replacement therapy, and then growth hormone is the icing on the cake. But if you made me choose between growth hormone and stem cells, just from the evidence that we've seen and how I feel, I would choose stem cells over growth. I do both. I've been on growth hormone for 12 years now, and stem cells for 8 years. I don't think anybody's done more than me. So, I do it all.
I'm curious, what do you notice? By being out, have you noticed anything specific?
It's tough when you're doing so many things, but
right.
You feel good. I've had pain, right? I've fixed my knees. I've fixed my lower back. I've fixed my neck. I've fixed a tricep tendon tear. And when you've been in pain versus when you're not in pain is a world of difference. I'm 42. I see some of my friends from high school. I just saw a few of them last week, and they're falling apart. They don't feel so good. They got all these problems, and I'm I feel great. So clearly something's working. So you see it more when you compare yourself to other people, But the immune system with the stem cells is huge. I'll see that people around me are all getting sick, and I'll get really tired and need a nap maybe, which I don't usually do. And I'll wake up feeling 100% while everyone else is getting sick, just because my immune system's so on point with this. So you start noticing little things. I'd say it's subtle. It's not oh, wow, I feel like I'm 20. No.
Right. Well, but you're not aging. I think what you're saying is you're not aging with your peers, if you will.
That's what I think. And look, I'm not the guy who's trying. I'm not like Brian Johnson. I'm not trying to live to 200 years old, right? That's not my goal. I just want to go as far as I can, as pain-free and as good as I can. That's my goal. And what I'm doing seems to be accomplishing that. So, that's what I try to explain to other people.
That's awesome. So do you get people coming in for weight loss?
Sometimes, with growth hormone, we initially did, but I'm very clear with people. There's better options for weight loss to start with. Like, everybody's all into Ozempic and these things now. We've been working with some of the top bodybuilders in the world for like the past 13 years. So, I mean, none of that is new. That's what's kind of funny. These are all things we've known about. I've had Ozempic for like a decade that people could buy from me, but we never really sold any until it got all popular. And I'm not a fan of it. Like the injectable makes me really nauseous. The pills gave me all kinds of skin rashes and honestly didn't curb my appetite. I'm weird like that. Like I'll eat no matter what. So like, it didn't work at all for me. And I don't have a lot of fat to lose because I do testosterone, I do growth. I find hormonal is the best place to start. Most people never look at their thyroid. So like we start with blood work with all our patients because look, I'm American. I know people don't usually get blood work done. At least they didn't used to. And we start with a very full panel. We look at like your red and white blood cells. We look at your liver, your kidney health. And we're looking at your thyroid because we learned from doing growth hormone. So many people that came for fat loss, their thyroid was out of whack. And if your thyroid's out of whack, I don't care how hard you try, you will never lose weight. Sure. So for anyone looking to lose weight, first thing you need to do is go do a full blood panel, look at your hormones, look at your thyroid, start there. And a lot of that stuff can be done in the US. I mean, there's great doctors for all of that if you find the right people. And then you can start adding things. So then my next step would be something like metformin.
Stephanie and I actually offer those services.
Oh, well, see, so there you go. I mean, that's where you got to start. So if you got that dialed in, I mean, people should be coming to you. They should be doing that. And that is where you start. And most people don't.
Well, it's the whole, Marnie and I always say, don't guess, test. And everyone is so quick for a quick fix. Everyone wants a quick fix. And so they're just doing what they hear, they see on social media, or one of their friends or family members is doing. And everyone's body is unique and different. And so until you get that blood work done, to your point, you don't know what's going on in your body. And you're only just guessing and throwing darts at the wall and throwing money potentially down the toilet by buying a bunch of products that, may not work. So yeah.
Totally.
For anyone out there listening, if you want to get your blood work done, we do at-home functional medicine lab testing. You can sign up for a consultation and you can, start to dive into some of these things that Josh is talking about.
That's where you start. And I mean, I cannot be more adamant about that. That's awesome. You guys do that. I could say that's exactly where you need to start.
Yeah.
So how expensive is it if a person wants to come into your clinic? And is there any kind of insurance? I'm guessing no in Mexico.
Yeah. Even in the US, because it's not FDA approved, like you get covered. We've had some people who are able to write it off, like with different programs. I mean, that sometimes you can get a tax break, but no, with us, like all of our prices are on the website because nothing drives me crazier than going to a website and I can't figure out what it costs. So I hate that. So I built our whole website. Like, I mean, you could write a book on stem cells just going through our website. It's got all the info, links to all the studies, all the prices. Like, we go out of our way to be as transparent as possible because we're not trying to help everyone. In fact, the whole reason I have that is to kind of like weed out who's not a good fit.
Yeah.
A lot of people, I'm sure you see that, right? Yep. Yeah. I mean, there's a lot of people this isn't going to be right for. There's things we can't help. So that breaks it down. For some people, what we do is extremely expensive. And I don't take that lightly. We try to keep our prices as low as possible. But if you compare us to our competitors, like we do 100 million IV is $3,850. But if you look at our competitors, say in Colombia or Panama, you're looking like $20,000, $30,000 for basically the same thing. And they've got all these celebrities endorsing them and all this stuff. And like, I don't want people coming to us and find out they're paying for some celebrity's treatment. Like, I don't think that's right. That's why everyone gets the same price. It's all listed there. A knee or a shoulder or a hip is like $3,300. But that includes an MRI. That includes your blood work. That includes 50 million stem cells. Like
and it's hopefully a one and done.
Yeah, and that's our hope. I mean, look, if it's 3rd or 4th degree arthritis, assume you're going to have to come back. But even the difference between 3rd degree arthritis and 4th degree is a world of difference, especially pain-wise. So some people are like, that's good enough for me, or they'll wait a few years. So you don't have to come back. That's kind of the goal.
Right. Right. I mean,
super interesting.
Yeah, this is super interesting. I'm like, oh, I want to come. I mean, and Mexico's not that far either, you know, like it's, you could tack it onto it. So if someone were to tack it onto a vacation, can you like come in and then like leave a couple days later? Or is there like it's an outpatient procedure, it sounds like?
Yeah, I mean, that's what everybody turns it into a vacation, honestly, because say you want to do a knee, right? That's probably the most common thing. So it's a 5-day trip. Day one, you arrive and rest. We can't do anything. So enjoy the day, have some fun and have a margarita. Like alcohol's not going to kill stem cells. If it did, we'd all be dead.
Good to know.
But, you don't want to drink a lot. There are, drinking doesn't help you, right? So, but then day two, we do blood work. We do the MRI. That takes maybe an hour. So then you got a whole day. Go to the beach. Go. I mean, I'm looking to my right, and you can't see, but I mean, we're right on the ocean. Like I'm looking at the ocean right now. We call it cheap Hawaii. It's like jungle mountains meets Pacific Ocean. So amazing tacos, amazing weather. It's good to go. But and then day three, we sit with the doctor and we review that. Because one of my biggest complaints with the U.S. system is you sit with the doctor and they don't tell you anything. Like, yeah, you're good. We'll do this. Like, oh, no, you're not good. Get out of here. Right. No, our doctors, I don't think we have ever had a consultation that took less than half an hour because we're going to review your blood work and we're going to explain what every marker is so you know where you're at and where your health is, because most people come in are healthy, but maybe their liver's a little off. Maybe their cholesterol's a little off. Well, now you have something to compare to. So in the future, like, if they want to go to you guys and do some new blood work, you can compare where you're at versus where you were. We go through the MRI image by image and the doctor's pointing it out, explaining, hey, this is your problem. This is why, this is how the cells can help, and make sure, because if we get in there and we see like you got a bad knee and there's tons of what are called osteophytes, these are new bone growth. And if you have too many, our treatment would be pointless. So we're going to say, hey, you came down here and, we're not going to charge you for treatment, but we're not going to do treatment because this isn't going to help, right? It's pretty rare that happens, but we're very upfront with people. And if we don't think we can help, we're going to tell you. So that's why we don't take payment until after we've done all that review, where everything's at. And then the cool part is that's good too, because we don't take the cells out of cultivation till late that evening so that we're administering within 24 hours. That way we don't have to freeze the cells. So day 4, you come in, like a knee treatment's going to take you like 10 minutes. You sit on the table, they inject your knee, you walk out of there and you're like, really? That's it?
Crazy.
It's really simple. And then the next day you could fly home or you could stay longer, but and then recovery, we say, hey, take 6 weeks light. You can still walk, do your normal day to day, but we want the cells they target inflammation. So let's not go work out and cause inflammation, because now they might start healing muscles and other things that you don't need to. Let's have them focus on what's inflamed when just day to day normal stuff. And so let's give it that 2 weeks of not much, 4 weeks of light rehab. We give everyone a rehab protocol. And then at 6 weeks, I want people to go work out, go for a jog, go play tennis, go to the gym, because again, they seek out inflammation. Let's flare it up and let's keep those cells going, because they're going to stay in there for 8 months to a year doing their job. And you do want to keep some inflammation. You just don't want to push it too hard and wear it out faster than it heals. But that's why you got to listen to your body. And that's what you do.
Wow. It sounds so easy when I think about people that have had like knee replacements and ACL surgeries and the amount of therapy and rehab and crutches. And it's crazy just what you're talking about.
Yeah. Do you want 6 weeks of light rehab or do you want 6 months recovering from a surgery? That's the option.
Right.
I'm in to give.
Seems like a no-brainer to me.
For people to consider and think about. And, we'll link this all up in the show notes so that all of you can go check out the DreamBody clinic in Puerto Vallarta, Mexico, and see like what the offerings are.
So is there anywhere else you want to point our listeners to in addition to your website, which we'll link up?
No, that's the main thing. Everything. Okay. I make sure everything's there. They can go through there and look at videos. And like I said, we can't share our patient info, but patients that want to film a video with us, we can share that all day long. So we do our best to, I think today filmed we have our own kind of series on there called DBC Diary. So we just filmed episode 40 today, which is it just shows the whole experience, right? Like you arrive at the airport, and that's a thing too, is look, we provide all the transportation. Our patients, everyone's coming from somewhere different. So flights are up to them. Hotels are up to them. We kind of have a zone north of the airport, but I have 8 drivers. Every one of them has a brand new Ford Expedition. They're going to pick you up at the airport, take you to your clinic, or take you to your hotel, take you to the clinic. Like you never have to step foot off your hotel other than the clinic if you don't want to. You'd be missing out on some great food, but and it is very safe here. I know Mexico gets a bad rap, but I've lived here for 17 years. I've been all around the country, and the thing is, they don't allow drug dealing here, so there's no bad neighborhoods. There's no like, hey, don't go to that part of town. That's the bad part of town. Like, that doesn't exist here. It's actually incredibly safe for like day to day. The border is a war zone, but like the towns, especially a tourist town like Puerto Vallarta, like this, I've lived in Seattle, I've lived in Southern California, I've lived in Vegas. Like, this is by far and away the safest place I've ever lived. I know it sounds crazy, but it's like, I've never seen a violent crime, anything. I can't say that about back home. Yeah.
Well, thanks for clarifying that, because I think you're right. There are people that have that as a concern. So that's great to know.
Well, as we wrap up this conversation, Josh, one thing we love to ask all of our guests is, what does the art of living well mean to you?
I think that, like I said, it's try to go as far as you can, as well as you can, as good as you can. And that's what I'm trying to accomplish. And I think there's definitely an art to it. So, yeah.
There is.
Awesome.
And it sounds like you're incorporating all that into your life and offering all these wonderful, I don't want to say new, but new for a lot of people, services that can really help improve the quality of individuals' lives. So thank you for coming on.
Yeah, I just love that people have options. Like we want to bring to our listeners, you don't have to do this, right? This is an option though. Maybe if you're having knee pain, instead of just going straight for the surgery, look around a little bit, see what works for you. Because, 5 years ago, I mean, this wasn't on my radar for sure. I'm guessing it hasn't been on a lot of people's radars. So the fact that these kinds of, I don't know if you'd call them therapies or procedures, are coming to light more is wonderful.
For sure.
Yeah. Well, thank you so much, Josh. It was great talking with you today, and have a wonderful day.
Have a great day.
Thank you.